So, we have convex occipital condyles moving on concave atlas facets. So they're going to move in the opposite direction to the head. This is an anterior osteokinematic, a posterior osteokinematic, yeah? All right. So if I flex C1, 2, the occipital condyles will glide backwards. If I extend them, they'll glide forwards. If I side bend, they'll glide to the opposite side. Good, easy enough. If I rotate there, the right occipital condyle moves backwards, that is flexes, and the left one moves forwards, that is extends. Is that okay? So that's probably the least intuitive part of this, is that extension is an anterior glide and flexion a posterior glide, whereas in the rest of the neck, of course, if I flex it, the glide is superior anterior, if I extend it, it's posterior and inferior. Okay. If I flex, right side bend and left translate, take my word for this, you're going to have to. The conjunct rotation is contralateral. Consensus again, but it's good consensus, and it works for what we're doing. So, flexion, right side bending, left translation, flexes the left joint, and unflexes the right. So when I flex, both condyles move posterior. When I side bend right, we got left rotation. So the left condyle moved further backwards into flexion, the right condyle moved out of flexion. Is that okay? So if I've got a limitation of flexion, I'm going to relax on it. Flexion, right side bend and left translation. What I'm testing is flexion of the left side of the segment. Now it may not be able to do that because the joint itself is jammed forwards, or the capsule at the back is tight, or the muscles are holding it. You don't know which one of those three things it is. So it's a restriction of flexion on the left side. Is that all right? If I extend it, side bend it right, we get the opposite happening. So as I extend, they glide forwards. As I side bend right, it rotates left. So the right one moves further forward, that is, pushes the barrier of extension, while the left one moves out of extension. So extension, right side bend and left translation is checking the segment's ability to extend on the right side. Is that all right? Now, normally you follow up this with pavons, don't you? In this case you don't. And the reason you don't is because the suboccipitals, at least some of them, run parallel with the joint surface. So even if the pavon is restricted, it still doesn't differentiate joint versus muscle. So the way you figure it out, do some hold relax techniques. If you get full range of motion afterwards, it's always muscle. Is that okay? No problem there? So, flexion left joint, flexion right joint, extension right joint, extension left joint. The axis for all this is for side bending through the nose, for flexion extension through the ears. So you don't want the ears coming up or down when you're extending and flexing, and you don't want the nose moving from side to side with the side bend. All of these are basically the motionless points that you're rotating around. Is that okay? Come down, give me another body, I'll do that again.